I'm Dr. David Ajibade, and I'm the founder and executive director of Brain and Body Foundation. So far, we've been talking about heart disease. In our last segment, we spoke about the miracle molecule, nitric oxide, why it's important, and some of the things or the foods or the ways we can produce nitric oxide. And then at the end of the segment, I mentioned probably to me, the most important and the easiest way to get nitric oxide, to get you the levels of nitric oxide that you need to get them to, especially as a black person. And that is through the protein or the amino acid called, wait for it, L-arginine. Okay, all together now. L, like letter L, and arginine. That's an amino acid. It's called a semi-essential amino acid. What that does, what L-arginine does, and again, there's been a lot of research on it, is that it helps, the body works on it, and the body produces nitric oxide from it, and then of course the body, nitric oxide helps to dilate the blood vessels and do a lot of good things. Remember in our last segment, we said that people with higher levels of nitric oxide in their system have lower risk of having a heart attack or a stroke. They have a better cardiovascular blood flow. By the way, I was saying that I was looking for solutions in the last segment. Well, this was the solution I came across for myself and now for my patients and for others. Substances, nutrients that have high levels of L-arginine. As a matter of fact, Dr. Ignaro, that's his picture you're looking at right now, he was one of the three winners of the Nobel Prize in 1998, and he specifically says you need about 5 grams of L-arginine a day to produce ample amounts of nitric oxide. Now, if you have high blood pressure or any other cardiovascular condition, that's too small. He said you need at least twice that. Some people take 3 times that of L-arginine. Some take about up to 4 times that. It's not a dangerous, it's not a toxic substance at all, even in higher numbers. Of course, it might hurt your wallet, but the bottom line is that it's safe. But so 5 grams a day is the minimum for everybody. Now, for black people, I would say you might even need 10 grams a day. Now, before you just run out to the health food store and buy a bottle of L-arginine, I have to caution you that L-arginine on its own doesn't work as well. It needs what is known as a supporting cast. So it needs other things like vitamin D3, we talked about that. It needs L-citrulline, it needs some antioxidants, it needs some things. So there's a nutrient complex. There's a nutrient complex that actually has all this together in the right amounts and in the right levels so that you can easily, rather than having to worry about, oh, what's the dose here, you can just have it all in one scoop. And that's what we try and provide it through our foundation. So back to Louis Ignaro and arginine. He's been traveling around the States and explaining these things. Now, before a scientist, before a researcher actually comes out into the open and starts promoting a specific nutrient, you will know that they've checked and cross-checked and double-checked and triple-checked to make sure they're saying the right thing, because he's taking a risk on his professional life by actually talking about these things, because as we know, medical professionals are loath to speak about nutritional supplements. We want to have the hard data and want to have the medications. We focus a lot on medications. But this is a hardcore researcher, a medical professional who is speaking about a nutrient. So I would say pay attention to what he has to say. I'm going to talk about a few studies, some excerpts from a few studies about the importance of L-arginine to the black person. Here's one. We studied 163 Caucasian and 132 African men respectively from the ages 20 to 70 years, 20 to 70 years. And we measured serum L-arginine amongst other things, and we compared with their blood pressure. What they found out, L-arginine levels were significantly lower, whereas blood pressure and pulse wave velocity were significantly higher in African men. Here's another one. We found that L-arginine concentrations were significantly lower in African men who presented with significantly higher blood pressure. Okay, we said that already. Our findings show that the relationship of cardiovascular risk factors with serum L-arginine and some of its catabolites is different in African and Caucasian men, and that this may be associated with a relatively higher prevalence of hypertension in African men. Our finding that African men presented with significantly higher BP and lower serum L-arginine, there's that word again, in comparison with their Caucasian counterparts, brings to mind the observations of others that an increase in diastolic blood pressure is induced by a decrease in nitric oxide in humans. So their eventual conclusion, and remember, these are scientists. They're very, very, very careful to say things outrightly. And so this may be the best thing you can get. And I'll say, just take it, don't take it with it, just take it and study more and hopefully do something for yourself about it. The conclusion, differential utilization of L-arginine, the primary source of circulating nitric oxide in the two groups. In other words, they're saying that we, white people and black people, use L-arginine differently. They now say that further investigation of these differences in the status of L-arginine and its metabolites is potentially useful. You know, they're being very couchy in their phrases. Is potentially useful in developing a strategy to improve cardiovascular health amongst African men. I don't think they can be more out there or more overt than that. L-arginine is needed to produce nitric oxide, and nitric oxide is critical for cardiovascular health. And we black people tend not to have enough of L-arginine and certainly not enough of nitric oxide. It's important for you and for your family, for the sake of you and your family, that you do what it takes to get enough L-arginine in your system. And remember, it's not on its own. You need to take it in combination with other nutrients. You need to get enough L-arginine in your system to maintain higher levels of nitric oxide so that you can hopefully have a long life, a long healthy life, and a long healthy cardiovascular system life as well. Thanks for listening.